Hello and welcome to today's episode on Life Saving Aid. Today we are going to be looking at chemical splash to the eyes in children and what we can do to help reduce complication and save the eyes. It's important to note that preventing this from happening is the best option. And how do we prevent chemical splash to the eyes in children? Ensure that chemical substances are properly stored away from the reach of children. Ensure that the lid over such chemical or harmful substances are properly closed, that it cannot be easily opened by a child. And as much as possible, wherever these harmful chemical substances are being stored, children should not have access to such environments. Now, in a situation whereby a chemical substance accidentally splashes into the eyes of a child, what are the actions you can take that can help reduce complication and preserve the eyes? A chemical can either come in liquid form or in powdered form. So in whichever form it comes, please and please, first remove the child from the source of that chemical. Next, you take off the clothing from the child while you wash the hands of the child. The reason being that if the hands are contaminated with this chemical or the clothing are contaminated by this chemical, the child can still accidentally reintroduce it into the eyes. Next, you take the child to a source of running water, and with the eyelids opened, you allow the water to keep running over the face of the child for 15 to 20 minutes. The reason is that any chemical that gets into the eyes, as water keeps running over the eyes with the eyelids open, it helps neutralizes the chemical, dilutes the chemical, and limits damage to the eyes. Why is it important to irrigate the eyes with clean running water before getting to the hospital? The reason is that if you leave the chemical there before you get to the hospital, it would have caused significant damage to the eyes. So even when you get to the hospital, little can be done to preserve the eyes. However, when you allow the eyes to be irrigated by clean running water, you help reduce the complication that can ensure from that event. Two, you help neutralize the chemical that have splashed into the eyes of the child. And three, it also reduces the pain that can result from a chemical burn to the eyes. Please, you must ensure that you remain calm, because if you don't remain calm, irrigating the eyes can be complicated, because when water enters the nose of the child can aspirate, causing another complication on its own. So please, you must remain calm to know that where you want water to get into are the eyes. You want water to flow through the eyes. So a few things you must not do when it comes to irrigating the eyes. Number one, please and please do not carry water and be washing or be rubbing the eyes of the child. No, it's very dangerous. What you will end up doing when you rub the eyes is to ensure the chemical goes deep into the eyes of the child. Don't try to blow the eyes of the child. No, that is also wrong. You end up worsening the condition of the child. So what do you do? For children less than 1 year of age that cannot take instruction, what do? You take a bowl of water, and in their bathing bowl, baby is properly positioned on your leg in a comfortable position. You allow this water, you drop it gently, you are on the bridge of the nose of the child like this, in a very comfortable way, something like this. So you see that the water is flowing to both eyes without getting to the nose and mouth. So you keep this going for 15 to 20 minutes. Now, for older children that can take instruction, you ask them to stand under a shower. While the shower is flowing down, the water gets into the eyes. So let them stand under a shower for 15 to 20 minutes. Another method you can use is that for children that can take instruction and they can sit on their own in a bathing bar, remember you are there to supervise the process. You are the one irrigating their eyes. What do? They should sit in the bathing baths, okay? Turn their head to the side like this. Their head is turned to the side. Pour the water gently from the side of their eyes like this. That way, the water is going from one eye to the other without getting into the nose and mouth before taking the child to the hospital. Remember, the reason why you must irrigate the eyes before getting to the hospital is to reduce the effect of the chemical on the eyes. Please do not scrub the eyes while you are irrigating. Do not blow the eyes while you are irrigating. This is why you must be calm at all time. Try your best to be calm. It's a scary situation, but you must try to remain calm. If the child is agitated, try to reassure the child. Remain calm while you carry out this procedure for 15 to 20 minutes while you make your way to the hospital. I hope this information helps someone out there. Share this video so that together we can help save more lives. Stay safe out there.